Good afternoon. I'm Paula Murray of HMSA's Provider Services Training Unit. Welcome to today's session. Today we're presenting Part 3 of our three-part learning series on payment transformation. We're hosting these webinars as a learning tool for new staff in pilot PCP offices, as well as in preparation for PCPs who just joined us in payment transformation and global payments in January, and for those who will be starting with payment transformation in July. Also, we have some providers who have already started on performance measures and will be moving into global payments. We'll be providing valuable information for those providers who will be joining us in payment transformation in July. So thank you for joining us this afternoon. We'll leave some time for questions and answers at the end of the presentation, but feel free to type in your questions in the chat box at any time during the presentation. In our first two sessions, we covered a lot of ground. In our first session in April, we gave you a brief introduction to payment transformation. Then in May, we took a more in-depth look at the details of the model, the PMPM bands, the performance measures, and we looked at the new format of the report to provider. Today, we'll be covering patient attribution, claims and reporting, the PCP toolkit, and why it's important to do well on the quality measures. We have recorded these sessions and they're available for viewing in the Provider Resource Center under the Training section. Today's session is also being recorded and will be posted in a couple of weeks. Okay, so let's get started. Patient attribution has been part of the Pay for Quality and PCMH programs from the very beginning. But under payment transformation, doctors are paying greater attention to the number of patients on their panel because it's a key factor in payment calculation. When you're looking at your panel in COSEVA, you're seeing in real time the members who are currently attributed to you. And remember, your payment transformation global payment is based on member attribution from the previous month. Your July payment will be based on members who were in your panel in June. For three of our lines of business, HMSA members select or are strongly encouraged to select a PCP when they first enroll with us. In the HMO plan, they pick an HMO health center and a PCP. In Quest Integration, they select a PCP or clinic. And in Akamai Advantage, they're encouraged to select a PCP to manage their care. When a member selects a PCP, we capture that information in our member database, and the PCP's name is printed on their member ID card. Currently, if these members want to change their PCP, they just have to call our customer service department. That change is made in our system and a new ID card is issued. Please note that members of our PPO plans are not required to choose a PCP. When we first implemented payment transformation, we tested a new process with our pilot doctors, and we're introducing this for all 2017 PCPs in payment transformation. This process involves having your patient sign a patient attestation form, which basically states they want you to be their PCP for routine health care and to coordinate their care with specialists. Please ensure all fields on the form are complete, including the HMO Health Center, and the PCP should be filled in. Keep a copy of all signed forms in the patient's medical record. The form is now available in English, Japanese, Chinese, Vietnamese, Korean, and Ilocano, and it is available in the Provider Resource Center under the Payment Transformation section. For HMO and Quest Integration members, fax the completed form to HMSA membership at the fax number printed on the form. Members will be considered attributed to you as of the month HMSA processes the patient attestation form, and that normally takes about 10 days within the time that we receive your fax. Members will receive a new HMSA membership card with the PCP name within 10 business days. The member will be added to your COSEVA panel for performance measures with the status of new and added to any care gap denominators by the 15th of the following month. To view a patient's care history and care gap sooner, just search for the member's name on COSEVA and you can see what's open for them. For Akamai Advantage members, you'll also fax the form to HMSA, but for PPO and Akamai Advantage members, you will be able to manually add your patient in Coziva. So you'll add the patient to your panel in Coziva, and then the member will be considered attributed to you as of the month you add the patient in Coziva. If you're making the change to a patient's assigned PCP in Coziva, first, please be sure the member understands your role as their PCP. The member must agree that they want you to be their primary care provider and provide or coordinate their care. They are also asked to complete the new patient attestation form and sign it. For our HMO, Quest Integration, and Akamai Advantage members, this form must be faxed to HMSA so we can update our system and issue a new member ID card indicating who the member has selected as their PCP. The fax is in lieu of the requirement that the member call HMSA to make the PCP change, so please be sure the fax is completed. For some of our plans, claims may be denied if services are rendered by a provider who's outside of the member's HMO health center and is not the member's PCP. Our PPO members currently are not required to choose a PCP. If they complete the patient attestation form, you may simply file it in your medical records. For members in our PPO plans, be sure the member understands your role as their PCP. They must agree that they want you to be their primary care provider and provide or coordinate their care. They're also asked to sign the patient attestation form. And since they don't need to select a PCP, if they complete the attestation form, you simply file it in your medical records, and please do not fax it to HMSA. Your staff will need to use the Add Patient function on Coziva to add the patient to the Pay for Quality program or Payment Transformation program to affect your member count for payment and for quality measures. When adding a patient on Coziva, a submission form will appear. That's what you're seeing on your screen, and you'll need to enter all necessary patient information. Then you'll click the circle next to the patient's name to confirm this is the patient you'd like to add. Click both boxes. The first box says you confirm the need to see the member's medical information. Then you click the second box to tell us to add the patient to Pay for Quality or Payment Transformation. So because the instructions vary by line of business, we have for you a quick summary slide that you can share with staff. It's really straightforward. For HMO, Quest, and Akamai, you'll fax the form to HMSA and add them to your panel in Coziva by clicking both boxes. For our PPO members, do not fax the form to HMSA, but be sure to add them in Coziva and click both boxes. Okay, so now we want to share with you a high-level introduction of HMSA's claims attribution logic. First, we're attributing members to the PCP the member selected upon enrollment. That information should match what is on HIN, and it should also match the member's ID card. Concurrently, we are respecting attribution to a PCP who most recently added that patient to the panel in Coziva. Of course, the patient must also sign the attestation form and have it faxed to HMSA for HMO, Quest, and Akamai. If the member has not selected a PCP upon enrollment, such as with our PPO members, then we'll use a claims algorithm to derive the PCP assignment. We look at claims for face-to-face encounters over the past 16 months and attribute the member to the PCP who was seen most frequently, or in the case of a tie, was seen most recently. And lastly, if a member hasn't selected a PCP or hasn't had any visits, there is no attribution. The PCPs in Payment Transformation have asked how they can monitor their patient counts in Coziva. Here are two places you'll be able to see that information. The first one is on the main dashboard, where you can see the number of patients who are in each line of business. The other place to find your attribution number is at the top of the registry page. So when you click on the registry tab on the left-hand side, when that page loads at the top, you'll see the total number of all of your patients that are attributed to you. Currently, the payment transformation view of data shows you account for all patients. From the panel, you can filter on the status column. Please note that current will give you your current payment transformation patient count. The number on the front page and the number at the bottom of the registry should match. This is probably the main category you'll want to monitor. When you filter on current, the list will include added and new patients. Added and new are lumped together in one filter. Added indicates a patient who was added by the PCP after confirming the selection. A form is signed and faxed into HMSA, and new indicates the member was added upon enrollment or through HMSA's claims logic. We also report patients who were declined by the PCP or who have left that practice, and various reasons could include their coverage ended, the patient may have died, or they were added by another PCP, or the patient was attributed to another PCP by our claims logic. And finally, you can filter on other. These are patients for whom the provider is not the member's PCP for purposes of the base PMPM or performance or engagement measures. The patient may have been seen for urgent care or for a consultation. The provider may have added the patient to get access to clinical information but did not check the box, the second box, which is to add the patient to pay for quality or payment transformation program. If you happen to notice a patient in the other category who you believe should be included in your panel attribution, double check to be sure you took the necessary steps to add them, whether you fax the form to us or check the box indicating to add them to your panel. So a few reminders about adding patients. If the PCP adds the patient to his panel in COZIVA and faxes the form back to HMSA, that takes precedence over other actions. HMSA will not allow claims logic to reassign the member to another provider. And if one PCP has already submitted an add patient request for that member for that month, no other provider will be able to add the member in the same month. So basically it's blocked, and a member can only be attributed to a PCP one time per month. After that, you'll need to wait till the following month to make a change. We've had reports in which PCPs have complained about other doctors who are grabbing or adding their patients. And we're just asking that all of you be respectful and professional about the doctor-patient relationship. Also be aware, too, that if you add a patient, you're adding that patient to performance measures and potential gaps in care. So while you will be increasing your attribution, which increases your global payment, you're also including possibly more gaps in care that you'll need to close before the end of the year. Here we have some quick tips about entering the required digits for the member ID card when adding a patient in COZIVA. For HMSA's PPO, HMO, and Akamai members, use one letter followed by 12 digits, and be sure to include all leading zeros. Do not include the blue card prefix of the first three letters. So if your card says XLHR and then the numbers, you're going to enter starting with the letter R and then all of the numbers including the zeros. For HMSA Quest integration, you'll use 10 digits and include all leading zeros. Also, do not include the blue card prefix of the first three letters. So if the card says XLQ and then the numbers, you're going to start just with the numbers, including all zeros. Okay, a few points about the monthly capitation payment, which is also called the bundled rate of care or the monthly PMPM or global payment. You can expect payment around the 15th of the month, and a hard copy check will be mailed to your claims payment address that we have on file. That's the same address we've been sending your PCMH checks to. Member attribution will be from 1 month earlier. So your July payment will be calculated based on your June 30th patient attribution count. To help your biller reconcile accounts, we'll send a payment summary report and explain the remittance portion of the check. We'll also be sending a full patient attribution list for that month's payment. If you're getting a global payment, do you still need to file claims to us? And the answer is yes, you will still need to file claims to HMSA for all commercial, Quest Integration, and Akamai Advantage members, just as you do now. Our claims filing process is the same. The filing of complete and accurate claims is necessary for several reasons. Number one, so we can give you credit when a performance measure has been completed, such as a BMI or tobacco counseling. Number two, so that we can capture the diagnosis codes for risk adjustment. And number three, so you know how much to bill members for their fair share of coinsurance and copayments. Be sure all of your staff understands the new measures, the procedure codes, and the diagnosis codes to be reported. Update your billing sheet or super bill as necessary. Let's talk a little about the federal plans. HMSA services 2 federal plans. You may be familiar with Federal Plan 87 or Fed 87. This is a commercial plan with a PPO benefit structure. Claims for this plan are paid under the global payment. We also have another plan called the FEP, or Federal Employee Program, and those claims will be paid fee-for-service separately from your global payment. The FEP plan is a nationwide federal employee health benefits program administered through the local Blue Cross and Blue Shield Association plans. Just like other out-of-state Blue Cross Blue Shield plans, these claims will continue to be paid fee-for-service, so you will continue to receive a separate check payment for these claims. When it comes to claims payments, we have some instructions for your billing staff. Your report to provider and claims payments will be issued on the same schedule. So please alert your biller that the claims payment portion will probably be smaller since we're making fee-for-service payments only for immunizations and certain plan members. We are changing the report to provider this year, so there is more detail for each claim and more specific information about the withhold amount, and that is what was paid under the global payment. We'll indicate the total approved for payment in this report, which is the sum of the total approved payment. And finally, we'll show the net amount due. For most providers, this may be a smaller amount than you're accustomed to. Billers will see the eligible charge on each line and the coinsurance or copayment the member owes line. They'll also be able to use that RTP for filing secondary plan claims. So here you'll see a sample of the report to provider when the service consisted of an office visit, immunization, and vaccine administration. We indicate the subscriber owes a coinsurance amount. We are paying on the immunization, but the rest of the claim is under the withhold or paid under the global payment. If you're starting global payment in July, your first report to provider may be a mix of claims from June, which are paid fee-for-service, and claims from July, which are paid under global payment. So it's best that your biller try to separate the claims by date of service so that the fee-for-service payments are properly accounted for. And if the biller submits all claims for services provided through the end of June before submitting claims for the dates of service July 1st and later, it'll help make reconciling your accounts a lot easier. Your Akamai Advantage report to provider will be very similar. You'll see a message code that will indicate the payment for this line of service was included in your global payment. So for Akamai Advantage, that code is 00061, and on your last page with the messages, it'll tell you that that line of service was paid under global payment. To view this view is the summary page showing the total of charges, the eligible charge, which was what was recognized and approved, and the payments by HMSA. This amount will match your payment for services paid outside of your global payment. So whatever check you're receiving should match the amount you see on the summary page. In this example, the primary plan paid benefits, and HMSA is a secondary plan applied the withhold in the coordination. Your biller will know not to expect separate secondary payment because it was paid under the global payment. Quest integration claims for regular Quest members will be paid using the monthly global PMPM. This will be indicated on the claim line as CAP. For Quest integration age, blind, and disabled members, their claims will continue to be paid fee for service. So here's a sample of our Quest integration claims report to provider. The sample is for the non-ABD members, and it'll show WHD or withhold will be indicated to the right of each line. And here's a sample for our age blind disabled members. Each line is indicated with FFS or fee for service, and you will be paid a separate check for these claims. So for claim servicing, please continue to use the same online and telephone resources you have been using for claims inquiries, and those are the numbers you see here on your screen. Okay, so we've covered quite a lot of material in the 3 sessions for payment transformation, and we encourage you to take time to understand the requirements of the program and to prepare yourself and your team for the journey ahead. Other PCPs who've been in payment transformation for about a year, and those others have started in January, we continue to learn from them. We try to take their feedback and incorporate it and make changes as needed. Many more resources are available to PCPs this year as a result from our learnings from the pilot doctors. So we hope you'll take advantage of these materials. Some success strategies for your office workflow. Pre-visit planning, so before your patient comes in for their appointment. Review your schedule of future visits and check Coziva for any outstanding care gaps. Depending on your current office workflow, you could flag gaps on a face sheet or your encounter form, your super bill, or put in an EMR alert. For your Akamai Advantage patients with RCC care gaps, go ahead and print out the patient's RCC list from Coziva by clicking Print Screen, and that'll help you be sure you don't miss any gaps in care. And check for any reports from specialists that may need to be addressed, such as a colorectal or breast or cervical cancer screening. On the day of the appointment, as part of your check-in process, have the patient complete the clinical depression and anxiety screener. For patient assessment, chief complaints, and vitals, always be sure to take their height, weight, and BMI. If their blood pressure reading is too high, anything above 139/89, go ahead and repeat the blood pressure reading. You could get a lower reading on subsequent measurements, and don't forget to document the appropriate codes for BMI and blood pressure on your claim form. That'll save you a little bit of time from trying to input it manually in Coziva. For tobacco screening, patients age 18 and over, be sure to ask about smoking status. Document that in the medical record and include the appropriate codes for smoking status on your claim form. We have a PCP toolkit, and it can be located using the link you see here. It's in the Provider Resource Center under Payment Transformation. We have posted all kinds of simplified explanations as well as tools to help you. You'll notice a couple of items highlighted in red on your screen. We receive a lot of requests asking for screening tools and performance measure codes. These tools will help you be sure you're properly coding your claims for credit, such as the combination of codes needed for tobacco use, or how to report some of the other measures that are new in payment transformation. We also have brochures to help your patients understand payment transformation. And if you like those, just let us know and we can send you a supply to hand out. Please be sure you go to the site at the link you see on your screen, because there's a ton of information here and it'll really help you be successful in payment transformation. We also have resources posted online to help you learn more about payment transformation. We have self-paced learning modules in the Provider Resource Center. Just go to hmsa.com/portal/providers, click on Training, then scroll down to Payment Transformation. We have 6 modules ranging from 10 minutes to 27 minutes covering various topics pertaining to payment transformation, such as performance measures, payments and claims, or PMPM bands. And of course, we've also recorded all 3 sessions of this series, and those are also posted online. And this is a really great way to work together with your team and ensure everyone has a good understanding of the new model. The 2017 Payment Transformation Guide is posted on HIN for your convenience. So just need to log into HIN and scroll down and you'll have the link to the Payment Transformation Guide. And we also have the PCP Toolkit available for you. So here I just wanted to walk you through locating the Payment Transformation Guide in HIN. After logging into HIN with your credentials, simply click on the link to the HMSA Payment Transformation Program Guide or Useful Links. And this will allow you to save a soft copy to your files, or you could go ahead and print it out for your reference. Okay, so that brings us to the end of the formal presentation. We have some time to take your questions. While we give you a few minutes to type in your questions, I wanted to take a moment to remind you to please go ahead and complete the evaluation form and fax it or email it back to us. If you need to leave right away, feel free to jot down your questions on the eval form and we can respond back to you individually. Also in your handouts, you have additional slides that we're not covering today, and these slides are for your information and will help you report your visits accurately to ensure you receive credit in COSEVA for the work you've done. So those are all the codes that would be reported to close out the care gaps or measures for payment transformation. Today's presentation will be posted to the Provider Resource Center along with parts 1 and 2 of this series, along with those other shorter topic-specific videos. If you still have questions, there are many resources available to help you. You can reach out to your physician organization leadership, or you can contact COSEVA for COSEVA-related questions. And you also have resources available to your PO, such as your strategic relationship managers and care coordinators. If you have questions about your claims, you can contact our customer relations area and they can help you resolve your claims payment issues. If you have additional questions, anytime, please feel free to write those on your evaluation form, or you can send it to psinquiries@hmsa.com. We're all here to help you be successful in payment transformation, so don't hesitate to reach out when you need some assistance. Okay, so now we're going to move on and try to answer your questions. If I cannot answer your question today, I will definitely take a moment to get back to you individually. So don't be alarmed. If I don't have an immediate answer, I may skip your question, but I will get back to you with an answer. Okay, so we have a question. Are patients still being auto-assigned to urgent care providers based on claims logic? From what I understand, this has been happening, and it's an issue that we're looking at because a lot of the urgent care providers are not truly PCPs, but we have some that are. So it's not a black and white issue right now, and we are still looking at how we can address that. Are there still denied claims under payment transformation, which would be a zero payment for a coding or billing error versus an approved clean claim with a zero payment under payment transformation? So you would still see a denied claim if there was an error. When you're looking at payment transformation, whether your claim is paid or denied, if you have the diagnosis or HCPCS code that we need to close out a measure or gap in care, we'll still take the data even though the claim was denied, but you probably do want to look at those denied claims and make the appropriate corrections because those could affect your members' co-pays. So once you do the correction to your claim, the member will probably receive a revised report to members showing what they owe for that claim. Okay, so if a patient is wanting to switch providers, should we have them wait until the end of the month? Definitely you want to not wait until the end of the month. Have them go ahead and fill out the patient attestation form, fax it back to HMSA, except if they're PPO, then you don't fax it. But go ahead and do it as soon as possible because we have seen situations where two doctors are trying to attribute the same patient during the same month. So the sooner you get that in, the better it is for you. And I just want to remind you, I know it takes a little bit extra time to look at the membership to determine if they're PPO versus HMO, but when you're faxing in those PPO patient attestation forms, which are not necessary, it really takes a lot of time for us to sort through them, and that takes away time from getting to the ones that we actually need to process. So by not sending us those PPO attestation forms, we can get to the HMO and Akamai forms and Quest much quicker. Okay, so we have a question. Can HMSA place a heading in COSEVA's patient attribution table that will indicate when the record was last changed, as sorting the table by that heading would markedly speed up the monthly reconciliation of new members to verify that month's list is correct? What you could do is sort by new, and that'll show you only the new patients who are attributed to your panel for that month, and so that should be a much smaller list than trying to look at your entire panel and decipher who was newly or recently added. Okay, we have a question by Biller stating we are not receiving an attribution patient list with the payment transformation payment as you stated. Why is that? I don't have a good answer why you would not receive it, but we could always get that list. If you haven't received it, just work with your strategic relationship manager and they can pull that list for you and get it to your PO leadership or directly to the PCP. Okay, can we ask patients over the phone about smoking? Do we submit claims without a visit code and just smoking codes? So for tobacco use, as well as for the anxiety and depression screener, you can do those over the phone and you don't need to submit a claim. Just go into COSEVA and do supplemental data and be sure to document it in your medical record. Okay, so here is the inevitable tax question. Slide 30 shows tax of $20.68. The customer owes $0 on tax. Do we write off all of the tax? Tax is an issue that has come up quite a lot recently, and at this point in time, we have to stay away from advising you on collecting tax. We're still working on how to get that message out to providers. Right now, your report to provider shows the tax amount, and tax is not a benefit for PPO members, so it advises that you can collect tax based on the eligible amount. So what is showing on your report to provider is tax based on your charge or billed amount. But if you look at the message code, it is saying that the provider could collect the tax based on the eligible amount. However, please stay tuned. We are working on coming out with an official statement on how to handle tax, and that should be coming out in the near future. How long do patients stay in the declined list or declined or left list before they go into the other list? I'm not too sure, but I would assume they would only stay there for the 1 month. Once you decline a patient from your attribution, you're not going to be receiving payment transformation PMPM dollars for that patient. The other list is really patients you've seen but are not in your attribution. So perhaps we can work on getting some clarity on how long they stay in the list. I'll need to check with COSEVA. So we have a question, why is the PCP not paid for seeing a patient for newly determined diagnosis, and the patient is sent to a specialist to review the same diagnosis? Okay, so it's not that you're not being paid for seeing a patient for a newly determined diagnosis. If that patient is part of your attribution, you are paid a monthly PMPM for that patient. You're not getting paid a separate claims amount, but that was all configured into your global PMPM band. Could COSEVA give us a date when the patient left our attribution list? Do we have a patient that are listed as left but still being treated by our providers? Okay, so anything that's in COSEVA, we need to work with them directly. It's not something that we from the HMSA side just goes in and makes a change. There's a process that we go through and we work with them on making the changes. When you have a patient who's listed as having left your practice but are still being treated by your providers, by all means, add them back to your attribution list. And then that'll ensure you're still getting your PMPM for that patient if you're still treating them. Okay, is there a way to appeal if a PPO member is being attributed to another provider incorrectly? We were told you can't retro-correct it, but if we notify you within the current month while the change is pending, it isn't actually a retro. Okay, so for what you need to understand for a PPO member, the whole premise of preferred provider plan is that they have the freedom of choice. So they could really choose to see more than one PCP, but unfortunately in payment transformation, they can only be attributed to one PCP. So it really depends if the other PCP has sent in that patient attribution, not sent it in, but if they made that change in COSEVA and had the patient sign the patient attestation form. If they've made the change in Inclusiva, then unfortunately you can't make another change until the following calendar month. As far as an appeal, this is really still a new process for us, and I don't think we've worked out all of the kinks yet, so I'll take it back to our Office of Payment Transformation and see how we can address that kind of issue. And so if your attestation form is more current than the other provider, if the patient signed 2 attestation forms within the same calendar month, you still need to wait until, like, let's say they signed 2 in June, you'll need to wait till July 1st to make that change because the system only allows 1 change per calendar month. Okay, so the question is, what do we do if we complete all the care gap measures, then the member shows up as declined and attributed to another physician? So unfortunately, there's not much you can do except maybe contact the patient and find out, are they seeing another PCP, or was that intentional that they want to switch PCPs because you've, obviously done a lot of work and worked with the patient on closing care gaps. So in that situation, once the patient is moved, you would actually need to take the step and contact the patient to change the situation and find out maybe it was a mistake and they didn't intend to change their PCP, but they didn't understand what they were signing when they went to another PCP's office, and in that case, just have them sign a new attestation form with your office and then go ahead and make the change in Inclusiva. And unfortunately, we don't want physicians playing tug of war with patients. Those are some of the issues that we're still working on because we have seen with some of our pilot doctors where, there's Dr. A saying Dr. P stole my patient and I'm going to take them back next month, and it's really a much cleaner process if you work with the patient directly to determine who they really want their PCP to be. We have more of a comment about making a form for families so parents don't have to sign separate PCP attestation for each child. That's a great suggestion. Understand where you're coming from, especially if you have one PCP for all of your children. I'll go ahead and take that back to our Office of Payment Transformation and see if we can come up with a form to do that. So some gynecologists are considered PCPs, and how is attribution done between traditional PCPs and those GYNs? Under payment transformation, OBGYN is not one of the PCP specialty types that we consider. So while they may be attributed Inclusiva to an OBGYN because HMSA recognizes OBGYNs as a PCP, for the purpose of payment transformation, they are not in the PCP program for payment transformation. So in that case, you could go ahead and have your patient sign the attestation form and move them over to your panel in Inclusiva. As far as getting an attestation or attribution each month, There's no time limit on the attestation form. It's when the patient signs a new form. So if they signed a new one each month to a different PCP, that's their choice in the PPO plan. Is it good for up to a year? Not necessarily. It's good for an unlimited amount of time until there's a change that happens, either that the patient signs a new attestation form or they change plans and are somehow assigned to a different PCP. Most times we can look within our system and see through claims logic where they belong. Okay, so I'm not seeing any new questions come up. If you think of a question that you didn't have time to type in, go ahead and put it on your eval form when you send that over to us, and we'll get back to you. And, of course, at any time, you could always email your question to psinquiries@hmsa.com. And with that, I want to thank you for joining us today and for working with us to implement payment transformation, and have a great rest of your day. Thank you.